So my name is Greg Alberts, and I'm the director of our neuropsychology services at NeurAbilities. I've been here about a dozen years or so, and my primary responsibility is to oversee the diagnostic evaluations, the clinical assessments that we provide, supervision to our trainees that are in the neuropsychology division, and basically try to promote clinical integrity and accuracy in the assessments and evaluations that we do. Neuropsychology as a field is really focused on understanding the role of brain functioning in terms of how it influences behavior. So by way of assessments, we do a range of evaluations that cover language, that cover memory, problem solving, executive functioning, and of course in the patient population that we see with autism or suspected autism, we administer kind of state-of-the-art evaluations and diagnostic assessments that help us differentiate the patient's presentation from conditions that could mimic autism or obviously may reflect an autism diagnosis. Yeah, in terms of our diagnostic evaluations, our organization is really driven by understanding and following the current science. So we rely upon those measures that are considered state-of-the-art, gold standard measures. That might include the Autism Diagnostic Observation Schedule, the Autism Diagnostic Interview. We use other rating scales and various parent observation and other reports to basically help us understand the whole profile of the child and try to refine our diagnoses as precisely as we can. So our neuropsychology department is part of an interdisciplinary team, and one of the primary responsibilities that we have, certainly in terms of the diagnostic work that we do, is really geared towards trying to understand what the comorbidities are in patients with autism. Many patients with autism have language disorders, they have anxiety disorders, they have sensory processing issues and so on. So our mission really is to try to distinguish, separate out, understand, quantify, and essentially provide a clinical profile that helps capture all of the the relevant clinical targets that might be a focus of ABA treatment or any variety of other interventions that are available.
And that team approach, that multidisciplinary, interdisciplinary approach is really what's key to our success and key to our patient success. The benefits of what we've created really is in our patient outcomes. We've had many individuals who've been to many top institutions around the country and locally, and just have not gotten the answers that they're looking for. And we have been able to provide them, at least if not the answer, we've been able to provide them a better outcome. Because we're very persistent. We're very persistent. We don't give up. We continue to search. We may not find something the first time, but we continue to stick with people and stick with their issues and try to come up with answers and better solutions. So it's really a combination of being very vigilant about understanding causes and contributions to these issues and coming up with solutions based upon those causes and contributions, and not just trying to suppress symptoms, but really understand the causes of those symptoms. And outcomes can be much better when you do that.